Hello, I'm Ibrahim Imam, and welcome to this short podcast on the 10 deceptive neurological symptoms you must never ignore. Neurological symptoms are perhaps the most diverse of all medical disorders. Getting to grips with neurological symptoms is challenging because they can manifest in any organ of the body. The brain, of course, controls all these organs, and the nerves course through every part of the body. Some neurological symptoms are by their nature intuitively worrying. No one needs to be told that a convulsion or loss of consciousness needs attention right now, or that loss of power or speech need checking out urgently. These are obvious red flag symptoms that don't need further exploration. Many other neurological symptoms are, however, surreptitious. They creep in quietly and often evoke no real concerns. These symptoms are very often non-specific, with nothing to indicate what they mean. This is when it becomes difficult to tell if they are red flags or red herrings. Red herrings are false red flags. How then can the man or woman on the street know when to be worried about subtle neurological symptoms? In this short podcast, I will count down on the 10 top deceptive neurological symptoms you must never ignore. The first is an alteration in gait. Any change in the way you walk should not be ignored. The gait is one of the most important clues that neurologists look at every assessment. It is indeed often the first thing he or she assesses as you walk into the consulting room. And it is a fully loaded feature because it tells a lot about what is actually going on. And the list of types of gait abnormalities there are is almost as long as the disorders that can affect the gait. The gait holds invaluable clues to the diagnosis of countless disorders, from stroke to Parkinson's disease, from muscular dystrophy to peripheral neuropathy. So, if the steps are out of kilter, do check them out now. The second is loss of perineal sensation. Loss of sensation anywhere in the body is concerning. Occurring in a localized part of the body, alone with no other symptoms, it is usually caused by benign issues such as a trapped nerve. It is, of course, a red flag when it persists or affects the whole of the half of the body. That usually needs no re-emphasizing. But one type of loss of sensation that is liable to be overlooked is when it occurs in the nether regions down there, what is called the perineal region. This can manifest as feeling no sensation when you wipe after using the toilet. This is a call to arms. And the main worry here is a lesion in the part of the lower spine called the cauda equina. This is where the spinal cord and the lower spinal nerves are confined to a small space and they can easily be compressed. This so-called cauda equina syndrome may also manifest with disturbances of bowel and bladder functions, but you do not want to wait until these happen before seeking attention. The causes of cauda equina syndrome are indeed worrying, and these include tumors, infections, blood collections, and disc bulges or prolapses. One to check out urgently. The third is flickering eye movements. The mechanisms that maintain the eyes steady as rocks whilst the body flounders all day long are some of the most sophisticated in the brain. That the eyes remain unperturbed by the constant head movements we engage in all day is one of the miracles of the nervous system. The eyes should only move when you want them to, and to the extent that you intend them to go. So when they start to move on their own, bobbing up and down or side to side for no reason, you must not ignore them. The usual cause of this is something called nystagmus, and the causes of nystagmus are legion. These include disorders of the brainstem, of the cerebellum, of the optic pathways, and even of the retina. So if the eyes flick, hurry to get them straightened out. The fourth symptom is droopiness of the eyelids. Neurologists love eyelids. This is because they are amongst the easiest things to assess. All the neurologist needs to do is to observe. And they do not like eyelids that droop at all. And this is especially when only one eyelid droops. Neurologists call droopy eyelids ptosis, and it is a symptom you ignore at your peril. There are many worrying causes of ptosis. One of these is the antibody disorder called myasthenia gravis. In this condition, the ptosis is usually on both sides, and it varies according to how tired you are. Another cause is compression of the third cranial nerve, one of three nerves that moves the eyeballs, and also the nerve that controls the eyelids. And the compression can be from something as bad as an aneurysm. So when they droop, look for a neurologist to perk them up. The fifth symptom is double vision. Seeing double must never be ignored, unless of course one has had too many drinks. Neurologists call seeing double diplopia, and it is a symptom that sends shivers down their spines. This is because amongst the serious causes of double vision are lesions that compress any of the three paired nerves that move the eyeballs, from tumors to aneurysms. Diplopia can also be caused by a stroke or multiple sclerosis, and these are lesions that disable the nucleus of these nerves. Simply put, seeing double must never be ignored. The sixth symptom is change in the size of the pupils. Okay, I admit it. It takes a bit of love, self or other, to pick out that one pupil is smaller or larger than the other. But if you do, or your better half does, it needs to be checked out straight away. Again, this is because of the sinister causes of this symptom that neurologists call anisocoria. Now, this is a challenging one for the neurologist to sort out, because he or she needs to first determine which of the pupils is abnormal. If it is the smaller one, then the condition is called miosis, and if it is a larger, it's called mydriasis. And then the neurologist needs to sort out which of the countless causes of either of these he or she is dealing with, some of which thankfully are benign, like migraine. But others are not so benign, and these range from a tear in the neck artery called dissection, leading to a condition called Horner syndrome, to lesions compressing the nerves that supply the pupils. Asymmetrical pupils? Check them out pronto. The seventh symptom is recurrent visual blurring. This is what neurologists call transient visual obscurations. This may be an early warning symptom of an increase in the intracranial pressure within the skull. The reason the vision blurs is because of the back pressure on the eyes, which become congested. This can be seen when the neurologist looks into the back of the eye with an ophthalmoscope. Okay, ophthalmologists do the same, and sees that the margin of the disc where the optic nerve meets the retina is blurred. The technical name for this is papilledema. Papilledema, just like its parent, raised intracranial pressure, is bad news. This is because it may indicate such worrying conditions as brain tumors, as well as thrombosis of the veins in the brain. And it may also indicate a more amenable but equally worrying condition called idiopathic intracranial hypertension. This is one not to ignore. And our eighth symptom is jaw pain when eating. Okay, I'm not referring here to either those with dental issues or those with arthritic joints. For the neurologist, pain in the jaw muscles when eating what they call jaw claudication raises only one red flag, a potentially disastrous disorder called temporal arteritis or giant cell arteritis. This is inflammation of the large arteries, and it can lead to blindness and stroke, amongst other worrying consequences. And this is because the inflammation can block the flow of blood in these vessels. However, there may be no need to press the panic button unless you are older than 50 years. Giant cell arteritis is almost unheard of under this age. But do press the panic button if you have any of its other worrying symptoms, such as fever, body aches, and weight loss. And we come to our 9th symptom, which is a numb chin. You will think this was something you could ignore, but don't. A numb chin is a red flag for the neurologist. And this is because one of its causes is metastasis or spread of cancer to the base of the brain. For some reason, these tumor metastases favor depositing on the 5th cranial nerve that provides sensation to the chin area. Other causes of a numb chin include stroke and multiple sclerosis, so equally worrying conditions. Thankfully, the benign causes of a numb chin syndrome far outnumber the malignant ones, but you do not want to wait too long to find out. And we come to our 10th symptom, which is twitching of the muscles. Like many other neurological red flag symptoms, a twitching muscle is more likely to be caused by benign reasons, such as drinking coffee excessively or overexerting yourself during physical activity, or sometimes even just by being older. These are then called benign fasciculations, and they are often transient and not accompanied by any other symptoms such as muscle weakness or wasting of the muscles. But that is not a call you want to make by yourself because of these potential sinister causes of fasciculations. And at the top of this list is motor neuron disease or amyotrophic lateral sclerosis. So if it twitches, check it out. If you found this podcast enlightening, do leave a comment or at least click on the like button. And you might also want to subscribe for future podcasts. And if you want to learn a bit more about your nervous system in a light-hearted way, why not check out my book called Surfing the Brain? And if you want to dig deeper into the academic dimensions of the themes I have explored, then you want to check out my website called Neuro Checklist. And to make sure you don't miss the next episode of this podcast, please subscribe to the YouTube, Apple, or Spotify channels of the podcast. Thank you very much for your attention.